My name's Andrew Armitage. I'm one of the orthopaedic consultants here who works at the Horder Centre, and my specialist interest is knee surgery. I often see patients who require revision knee surgery, and this is importantly very major surgery. The most common reasons for having to revise a knee is if it's loose, which is normally based on having been in a long time, if it's infected, which is unfortunately a rare but significant complication of a primary knee replacement, and they are the two main reasons. What we have to take into account is how it's affecting the life of the patient, how much bone has been lost, and what other medical factors are involved that may increase the risk of surgery in view of the fact it is major surgery. That said, providing it is safe for the patient to undergo the surgery, the results are actually very good, particularly for loosening. And one can convert a painful, untrustworthy, unstable knee replacement into a trustworthy, comfortable, reliable knee, and ultimately this significantly improves the quality of life for that patient. There are the normal risks associated with a replacement surgery, which do include infection, blood clots, wound issues, particularly if there's been a limited range of movement beforehand, and if there's been multiple operations in the past. Death, unfortunately, always has to be mentioned, though it is a rare but obviously very significant complication. The surgery normally takes between 1 and 2 hours, depending on the complexity, and most patients are in hospital between 2 and 5 days. This is the standard treatment for a loose knee replacement. Revision for infected knee replacements, again one has to do a great deal of work up beforehand to identify ideally what sort of organism it is, how the knee replacement itself has been affected, and what the skin quality is like around the wound. One can do this either as a single stage or as a two-stage procedure. If you have a very sensitive organism and good healthy bone, one may consider doing this in a single stage. If you're concerned about the severity of the infection or the quality of the bone or the quality of the soft tissues, it's slightly more common to actually do this as a two-stage procedure. What that means is initially you open up the knee and remove all foreign material, so the metalwork and any unhappy tissues associated with it. You then put normally a cement spacer in that looks a bit like a knee replacement that's full of cement, and allow the wound to heal and let everything settle down. Normally one identifies an organism at that point, and the patient is normally on antibiotics for 6 to 8 weeks. Then one normally stops the antibiotics, leaves the patient off antibiotics for a couple of weeks, and then takes further samples to see if one's eradicated the infection as best one can. If all those samples subsequently come back negative, you then go ahead and do the second stage revision, which essentially is re-implanting the metalwork we've taken out previously. In the interim, we do put this spacer in that looks akin to a knee replacement, which allows the patient to move their knee and maintain mobility, which is very important to keep muscles working and allow us a more straightforward operation when we come to re-implant, and similarly the soft tissues are more supple, pliable, and hopefully therefore less likely to require too much clever soft tissue surgery or even plastic surgery.